Hi guys, Rachael Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, we're going to be talking all about otosclerosis. Coming up. Although they're only a tiny part of your body, your ears are responsible for providing one of your 5 core senses, hearing. But just like any other system in your body, there's always the potential for something to go wrong. Hearing loss can develop over time with age, can be acquired through medical conditions or loud noise exposure, and can even be the result of genetic disorders. One such disorder is called otosclerosis, a condition in which an abnormal buildup of calcium around the base of the stapes stiffens the middle ear system, resulting in progressive hearing loss. Nearly 3 million people in the United States have this condition, with the largest group affected being Caucasian women between the ages of 20 and 45. Researchers theorize that the onset of this condition is due to hormonal changes during this period, especially for women that have children. While spontaneous otosclerosis can occur, researchers are currently trying to identify genetic markers for this condition, given its high rate of heritability. In fact, this video was prompted by a patient who was seen for a comprehensive hearing evaluation after completing extensive health and genetic testing. The testing revealed that he was in the 99th percentile for developing otosclerosis, but he had no clue what that condition even was, or if he even had it. If you're wondering if you or someone you love might have this condition, stay tuned while we discuss the symptoms, how it's diagnosed, and what can be done to treat it. But before we dive on in, please take a moment to give this video a thumbs up. It really helps bring our videos to a wider audience. And of course, if you have not yet already, go ahead and hit that subscribe button with notification bell so that you never miss any one of our newly released videos. Now, in order to know what otosclerosis really is, we first have to know just how we hear. Hearing is actually very complex, requiring several moving parts to work together perfectly in order for you to hear your best. The human ear is comprised of 3 distinct systems: the outer ear, the middle ear, and the inner ear. First, the outer ear captures sound vibrations and funnels them down to the eardrum, otherwise known as your tympanic membrane. These vibrations are then transferred through the 3 middle ear bones, the incus, malleus, and stapes, before entering the inner ear. The inner ear houses the cochlea, our hearing organ, that has over 40,000 hair cells. These hair cells can be divided into 2 types: outer hair cells and inner hair cells. Outer hair cells are responsible for amplifying sound vibrations to the point that they stimulate the inner hair cells. Inner hair cells then send meaningful information by way of the auditory nerve up to the brain, where they are then registered as a particular sound. If any part of this hearing pathway is disrupted, your hearing can be impacted. In the case of otosclerosis, the area connecting the middle ear bones to the cochlea begins to develop bony overgrowth. This overgrowth results in ossification or hardening of the joint between the stapes footplate and the oval window of the cochlea. This reduces or even prevents the vibration of sound from entering the cochlea, which results in less sound making it up to the brain. This type of hearing loss is called conductive hearing loss, as it is caused by an issue with the transfer of sound from the middle ear space to the inner ear, rather than a problem with the inner ear itself. In very rare cases, this abnormal bony overgrowth can extend beyond this joint and can even result in sensory neural hearing loss and dizziness. Otosclerosis can even create or increase tinnitus perception, as is seen in somewhere between 50 to 75% of cases. Individuals with this disorder will often exhibit symptoms similar to any type of hearing loss, such as an increasing need for repetition, difficulty understanding dialogue on the TV, and a hard time hearing soft, fast, or distant speakers. However, these symptoms become more significant as the condition progresses, sometimes even leading to severe levels of hearing loss. In any case that hearing loss is suspected, diagnosis begins with a comprehensive hearing evaluation, and otosclerosis is no different. During a hearing evaluation, tones are presented through headphones to test the entire auditory system through the outer ear, middle ear, and inner ear. The response to these tones, called air conduction thresholds, are indicated with a red circle for the right ear and a blue X for the left ear. The further down these symbols fall on the audiogram, the worse your hearing, as more volume was needed to get a response. Tones are then presented through a bone conduction headband that skips the outer and middle ear, testing only the inner ear. These responses, called bone conduction thresholds, are indicated using red brackets for the right ear and blue brackets for the left ear. In the instance of normal hearing and sensorineural hearing loss, responses obtained through headphones versus the bone conduction headband are generally the same. However, in the case of otosclerosis, there is a noticeable difference in responses between the two testing methods, called an air-bone gap. Otosclerosis can result in mild air-bone gaps of 15 decibels or progress into severe air-bone gaps of up to 65 decibels. Many other conditions can cause conductive hearing loss and air-bone gaps, including middle ear infections, eardrum injuries, and even cholesteatomas. So when does a hearing healthcare provider begin to think that otosclerosis might be the problem? Otosclerosis can be distinguished from other disorders due to a characteristic Carhart notch. This notch, first described by Dr. Raymond Carhart in 1950, is an elevated bone conduction score at 2000 Hz that isn't typically seen with other middle ear disorders. This is likely due to the stiffening of the middle and inner ear system, disrupting the vibration of fluid in the inner ear. This notch is often the nail in the coffin for the diagnosis of this condition and often results in referral to an ear, nose, and throat physician who can order a CT scan for confirmation. Another test a hearing healthcare provider might use to help build a complete diagnostic picture is tympanometry. Using some gentle air pressure, tympanometry measures the mobility of the eardrum and middle ear system. In the case of otosclerosis, tympanometry often reveals limited or no mobility due to the ossification in the middle ear space, but in some cases can remain completely normal. But once otosclerosis is definitively diagnosed, what can be done to treat it? The first treatment options for otosclerosis are surgical procedures called stapedotomies or stapedectomies. In a stapedotomy, tiny holes are drilled or lasered into the stapes footplate, which is then used as an anchor for the attachment of a microprosthesis. In a stapedectomy, the stapes bone and footplate is removed, replaced entirely with a microprosthesis. The goal of each of these procedures is to remobilize the stiffened middle ear system, allowing sound vibrations to travel through appropriately. Surgery success is determined by comparing hearing evaluations from before and after surgery, with the main goal being to close the air-bone gap and restore hearing. Here's an example of a successful procedure in which the air-bone gaps seen on the hearing test before surgery have reduced significantly on the hearing test completed after surgery. However, it should be noted that outcomes for each of these procedures is unpredictable depending on the severity of the case. Research suggests a broad range of successful outcomes, somewhere between 18 and 90%. In addition, only a limited number of studies have been completed on the effectiveness of these surgical procedures over time, making it difficult to say for certain if the results of these procedures are lasting. Another surgical option is a bone conduction hearing aid that uses a surgically placed abutment in combination with an attachable hearing aid. This device collects and transfers sound vibrations directly to the cochlea, bypassing the middle ear space. But if surgery is not an option or not something that you are willing to do, you're in luck. Most styles of modern hearing aids are capable of providing adequate amplification to overcome a majority of conductive hearing losses. In fact, I have personally worked with dozens of patients with otosclerosis who decided to forego surgery and have been extremely pleased with their hearing performance. This treatment method should always be facilitated by a provider who follows comprehensive best practices, including more frequent and regular hearing tests, to make programming changes to your devices as needed. Depending on the progression over time, hearing aids may struggle to provide appropriate amounts of amplification to overcome the hearing loss, at which point surgical intervention may be recommended. Fortunately, if caught early and treated appropriately, most people with otosclerosis can experience successful hearing outcomes with whatever treatment option they choose. If you think that you or someone you love may have hearing loss, the first step is definitely getting your hearing checked. This is especially true if you have any family history of hearing loss, and this includes even more distant family members like cousins. A hearing evaluation will reveal if there is a hearing loss, and if so, will also confirm the type and severity of hearing loss you have. This lays the framework for treatment recommendations, including bone-anchored hearing aids, traditional hearing aids, or surgery. If you are found to have this condition, it is critical that you work with a hearing healthcare provider who's not only aware of this condition, but who's willing to follow comprehensive best practices in order to have you hearing your best. As always, you can check out hearingup.com for a list of providers in your area that follow comprehensive best practices and can offer you support and guidance through this process. That is it for this video. I hope that you found this information nice and useful. If you liked it, go ahead and give it a thumbs up and share it with someone that you feel could use it. And don't forget, if you haven't yet already, make sure to hit that subscribe button with notification bell so that you never miss any one of our newly released videos.